Rob, thanks again. I mean, this is a pleasure, real pleasure. And to be honest, I had no idea that you'd undergone a liver transplant not that long ago. I mean, I work at the center where you got it. So it's an amazing story. I read the piece in CMAJ as well. It was so well written. And I think it was very, very impactful. And so fantastic to have a chance to talk with you. So maybe just start off, if I can just ask you, for the sake of the audience, just if you can introduce yourself, let us know who you are, what you do, and
Sure.
so forth.
So my name is Robert Stewart. I'm a urologist. I work at St. Michael's Hospital and have done so for the last 21 years. Prior to that, I actually worked at UHN, at your place, for 2 years. I've been married for almost 34 years to Margaret Herridge, and I have 3 grown children who are wonderful. I love my work, and I never, ever anticipated having this illness befall me. This was just so off my radar screen and really challenged me with a lot of aspects of being a physician and a patient at the same time. And I know we'll have an opportunity to discuss some of that.
Fantastic. Thank you. I think that's an incredibly important insight that many of us don't have. And from your perspective, it'd be so valuable to find out more about that. When did you first note or sort of feel that something wasn't quite right in terms of the illness that sort of led to the transplant? What were the circumstances around that?
Well, the circumstances were essentially a visit to see my daughter, who was doing a term at a university in Singapore. I went for a week just to visit her. She'd only been there 6 weeks and was just getting settled. And I thought it'd be sort of a fun father-daughter week. And I said, what do you want to do in Singapore? And she said, Dad, we're not staying in Singapore. We're going to Bangkok. And she said, it's so much more fun, because she was 21 at the time. And so I said, well, I'll take care of all the arrangements, Sarah. Just get me a ride on an elephant, if you would. And she said, Dad, that's animal abuse. You can't do that. But she said, I can take you to an elephant sanctuary and you can pet them and feed them, etc. And so we hired a driver who took us to this place outside of the city. It was really sort of in the jungle somewhere. And on the way, we stopped at this outdoor food market to buy elephant food. Well, I didn't know what that was, but I quickly learned it was corn and bananas. And that seemed easy. And so I was wandering around this market and saw this pile of bananas and on this low table. And I reached into the pile and I felt a bite on my hand. And then I saw this gray snake slither away. I didn't see its face bite me, but I saw the holes that it left in my hand. And I immediately Googled it to figure out whether this was a poisonous viper and that I needed to get to an emergency room quickly, or whether this was probably a non-venomous snake. And I cautiously concluded it was the latter, and I would just get on with my day because I was going back to Toronto the next day. And I thought, I'll deal with whatever eventuality happens when I get back to Toronto. And so that's how it kind of started. And by the time I got back, I had a pretty wicked cellulitis from my fingertips all the way up to my shoulder, and got off the plane after a 21-hour flight with a temperature of 40. And I was really feeling, distinctly unwell. And so the next day, a plastic surgeon at our place probed my hand looking for a retained fang. And I said to her, well, isn't that what x-rays are for? She said, well, I think maybe your tendons are infected. So she put me in a plaster cast, but and put me on some antibiotics. But I noticed after a few days, I just wasn't getting better. And so I consulted an infectious disease expert at your place. And he said, I don't know what lives in the mouth of a Bangkok snake, Rob, but you need to ramp up the antibiotics, which we did. And it cleared the cellulitis, but then I developed all of these symptoms of Stevens-Johnson syndrome, and I got a rash that lasted a couple of months. I started to develop high fevers that sort of came back after they had subsided a little bit, and arthralgias, and then I sloughed all the skin on my lips and the inside of my mouth, and I had this profound fatigue. I've just never felt so fatigued in my life. And he was so nice and supportive of me, and said, there's not a lot of really good treatment for this. It may take 6 to 8 months to resolve completely, but just be patient, sit tight, it'll probably go away. But in the background, I sort of knew that there could be complications of Stevens-Johnson syndrome. And I was aware, I'd heard stories of some people ending up in renal failure, for instance. I was aware of liver disease as a result of this immune reaction. And so it was lurking in the back of my mind. And after 6 to 8 months, the fact is I wasn't getting better. I was starting to get worse, and I was becoming encephalopathic. And I was finding it really, really difficult to do my work properly. This is now November. And so I just took a voluntary medical leave of absence to get a proper diagnosis, find out what was going on. And it didn't take more than 24 hours of blood tests and scanning. And then I was in the liver transplant clinic for an assessment. So it all happened very, very quickly. Just sort of came crashing down on me in a way that was shocking. And I was so ill prepared for it.
Oh my goodness. That's an incredible story. I mean, that's unbelievable. And it did accelerate fairly quickly at the end there, where you mentioned that essentially after a little bit of a workup, you're noted basically the liver wasn't functioning.
Oh yeah, that all happened within 24 hours, and then I was, seeing the hepatologist in the transplant clinic.
Wow. And in that process, did the discussions around living donations start when you had those initial meetings, or did that sort of take a little time?
No, it was right at the outset. They said you should look for a donor, and I thought, I don't know how to begin. There is no clear algorithm for this. And while you folks in kidney transplantation are dealing with the people who are just at the entry point of this search for a living donor, but we as transplant surgeons get involved much later in the process. And so I really didn't have a lot of experience with this, but I got some very good advice from the liver team who suggested that Margaret, my wife, be my advocate, because they said it's just so awkward for you to be the person who's asking, and also for the potential donor, it can be really awkward as well. So if someone can advocate for you, it really helps the process. But we didn't really know where to begin. But Margaret took it on. She did it with incredible energy, and she was up at 4 a.m. sending emails all around the world, literally to colleagues everywhere and every day. That's what it took. That's what it took. But then it ultimately circled back to my own hospital, a colleague, a physician I know. And so that was really kind of ironic that after this international search, someone I work with in the same hospital became my donor.
That's a fantastic story. And actually, of course, I know Marie as well. And it was just really well laid out in that article. But and I know your wife quite well. She's a few doors down, and I have no doubt that's the kind of energy you talked about and the commitment that she had. There's no doubt that I could see that happening. That's wonderful. And I guess ultimately then it worked out that you had found Marie had agreed to be a living donor. And just curious from your perspective, how did the assessment process go about, and how did you experience it? What were your thoughts about it? And then moving forward there afterwards through the surgery and the recovery, just your sort of sense of it and your experience of the whole thing.
Well, the assessment was extensive, as you might imagine. I mean, I think I've had every square centimeter of my body imaged at least once. So it was really extensive. And I first got this glimpse of the idea that being a critically ill patient is a full-time job. They schedule you for so many investigations. They ask you to do many things, lots of blood work, picking up prescriptions. All of this stuff takes so much time. And as a physician, I was just a little bit not thinking of the impact of the things that we ask of our patients as I went through it myself. And so that was a bit of a surprise. It's a lot.
Interesting.
But the workup, happened and everything seemed fine. And Marie and I actually were introduced as donor recipients about 3 weeks before the surgery. And so we I was surprised because I had no idea that she had come forward. And this is another point in the process that I know you're very familiar with, and that is the separation of recipients and donors. And I fully understand why that has to be that way, because a potential donor can have a change of heart, etc. And you really need that anonymity initially. But I'll tell you, for the potential recipient, it is just frustratingly opaque. You know, the analogy that I use, it was like it was being told to run a race by my doctors, but not being told where the finish line was, and just being cheered onward, saying, you know, we'll tell you when it happens. But I couldn't bring that finish line into any kind of clear focus at all. And I found that really frustrating.
That's a really great analogy, actually.
And I guess I felt really helpless as well. I mean, you know, I was used to steering the wheel, being in the driver's seat, and all of a sudden I had to sit in the passenger seat and let somebody else steer for me, because I couldn't make myself well. I couldn't heal myself. And just getting my head around that idea, that concept, that I had fully and completely become a patient myself, and I was no longer a doctor in this, that was a psychological experience that took some time to accept. I found that challenging.
Absolutely, I can only imagine. And how was the surgery itself and the recovery period there afterwards?
The surgery was brilliant. It was absolutely brilliant. I had a fantastic team of surgeons, but not just surgeons, the nursing staff, the coordinators, like the entire multi-organ transplant team at UHN were so supportive, so fantastic, so skilled. So my recovery was, I was out of the hospital in 5 days. And I probably, it was the steroids speaking, but I didn't really experience any pain or anything. You know, it was like strange. I expected much worse. But Marie was out at day 4, and I left the following day, and she looked fantastic the day she left.
And we know how active she is and stuff, so that certainly probably helps in terms of recovery for sure.
Oh, I'm sure.
Yeah. And then subsequently, of course, you've continued your follow-up and hope you look really well. It's great to see you. And yeah, so I hope all is going well and you're feeling well.
I feel 100%, absolutely 100%. You know, my mind is clear. I've been back at work for over 6 months, 8 months now, and I'm working virtually full time and enjoying it immensely. It was really hard to be away from work for that period of time, but everything has gone so smoothly, and the function has been perfect. And you know, I've been so fortunate. I really do feel very fortunate.
Oh, that's amazing. Rob, you mentioned earlier your experience as a patient and how that sort of intersected with your knowledge and, of course, your work as a physician. Could you elaborate on that a little bit? I think that's an extremely important point you raised, and something that none of us would be able to even imagine unless you actually experience it firsthand. So how did that sort of come about, and how did you sort of resolve some of the internal conflicts and difficulties that you encountered?
Yeah, thanks for the question. I had to learn to become a patient. It took time. Initially, I would go to my clinic visits, and I would sit in the waiting room and try to convince myself that I'm not like this person who's sitting beside me. That there's something different here. I'm not really a patient. I'm not really as sick as they say I am, or whatever. You know, it's that medical mantra that we have. You know, push harder, push even harder, which is so not conducive to healing. You know, it's something that we are challenged with, and I think that that's something that our whole profession needs to embrace and reflect upon. But so there was this initial period where I didn't really get the idea that I was a patient, but then I became one, and I believed that I was, and I started to separate this idea that, you know, I can show compassion and empathy to my patients, and it's very genuine, but I was flagellating myself. I was beating up on myself for not being able to heal myself because I was a doctor. And, you know, it was that gradual process of learning to become a patient, learning to be okay with the fact that you're needy at times. You know, you need help, and it's okay to ask for help. I mean, doctors need to give themselves permission to be as vulnerable as our patients, for whom we, you know, provide our very best care. And oftentimes we just don't get there, and we deny. We're great deniers. We obfuscate a little bit, and sometimes you are the patient, and when you're sick and needy, as I was, there was a time when I just had to give up the control and accept the help.
Important. Yeah, and I guess traditionally we're the culture and the teaching is that physicians should always sort of just suck it up, and it's we're supposed to be in a position where we are healing, but very very rarely are we asked to think about our own sort of mortality and the need to heal as well. So those are incredibly important insights. And what would you say has been the impact in terms of to your broader family and sort of your life at home and so forth now that you're on the other side of all of this?
Well, for my family, it's wonderful because, I think they see that I'm just so much better, and they could see that I was getting sick in a way that probably, because I was a little bit confused, I didn't appreciate to the same extent, but they saw it very, very clearly. And they challenged me on it and said, you've got to get yourself to a doctor. And they were absolutely correct. But the outcome has been so positive and so happy that it's just been a fabulous thing for my family and for Margaret in particular, I think, because she just worked so hard to find someone on my behalf. And for that, I'm so grateful.
Oh, that's great. And would you say, you mentioned a little bit about your experience's impact on the way you doctor now. Could you give us elaborate a little bit more? As a physician, how has this experience changed you?
Yeah, I alluded to it a little bit earlier in that I have this much greater appreciation of the things we ask of our patients and all that requires, and it's a lot. The other thing is that I have a better sense of what the patient wants to receive from their doctor during a clinical encounter. When your doctor leaves the examining room, it's an event that is strongly punctuated, if you will, because you feel it. And so I now routinely, when I'm seeing patients in the clinic, at the end of a visit, with my hand on the doorknob to leave the examining room, I look over my shoulder and I look into their eyes and convince myself that their agenda has been fully met. And if I can't convince myself of that, I sit down and keep talking. So it really changed the way I think about that doctor-patient interaction and what the patient needs or expects from that interaction, and sometimes the lack of synchronization between the patient's expectations and the doctor's expectations, and it can happen. And it's just all about communication. And the team that I had at UHN communicated those aspects so effectively and brilliantly.
Fantastic. That's
hey guys,
amazing.
can we pause just for 1 second?
Sure.
There seems to be some background noise. Does anyone know what that is?
I do.
Okay.
There's a guy, I'm on the 9th floor, and there's a guy hanging outside my window cleaning it.
All right. Okay. Well, carry on then. There's nothing we can do about that.
It was unexpected. I'm
Okay.
sorry.
Yeah.
No worries. Okay.
This makes it sort of unplugged. That's fine.
For sure.
It's a real deal.
Yeah. Okay.
Rob, in reflection through this whole experience, is there anything that you would do differently or approach slightly differently than you did the first time around?
I think if, as I reflect on that question, Joe, I wish I had listened to my family sooner. I was very stubborn because I didn't want to believe this. And, and then immediately you have this experience of having your life expectancy reduced to some fairly blunt statistics. I mean, they don't mince words, and they tell you right up. And my very first appointment there, they said, you've got a 2-year mortality risk of 50% right now. And when it gets to 2 months, 50% mortality risk, we'll prioritize you for a deceased donor. But in the meantime, if you can, you should be looking for a live donor. So you know, that was really difficult to digest because it just came on me so quickly. But I think that if I had been just a little bit more sensitive to what, you know, my family's observations were earlier on, I think I would have gotten to the doctor a lot sooner. I don't know if it would have changed things dramatically, but it would have, I think, minimized a lot of grief that my family members had to go through.
And what do you think may have been the main reason why sort of you were a little resistant to listening earlier, as you said?
Well, I guess I was just scared.
Yeah.
I was so frightened of what might be because I felt terrible, really, and it was getting worse. So I knew something was happening in the background, and I think I just didn't want to face it. I didn't want to hear it. I kept hoping against hope that it would turn around spontaneously, you know, this type of mentality.
Yeah, which again, of course, under the circumstances is understandable, but yeah, no, absolutely. So what would you say, what are the next steps for Dr. Robert Stewart now that you've gone through all this, and what's next for you?
This session, something I'm very happy to be a part of, is one little step along the way, but the way I think that I can help to try to pay it forward to the program is to be a strong advocate for a live donor transplant because it is so important. It's such an important element of the entire enterprise. And I would just like to give back in any way I possibly can to the program and to talk it up. I mean, this capacity that we have as humans to be able to be a donor of an organ or part of an organ that actually can save a life is so powerful and profound, you know? And the question is not why be an organ donor, it's why not be an organ donor.
That's fantastic. Yeah, no, absolutely. Yeah, wow. You know, you've actually given me some things to think about as well. Any things that I have not asked, or anything that you wanted to sort of say to the audience reviewing this that you wanted to sort of sum up or provide sort of words of wisdom on?
Well, it's hard to sum it up because it was such an experience that was multifaceted. So I can't really, you know, sum it up extremely concisely, but it was a very scary experience for sure, one to be devoutly unwished for, but it happened to me. And I got sick and I learned to see myself in a new and vulnerable and much more human way, I think. And I think that was good for me personally. The program was fantastic. Marie, of course, is a hero, and I'm just one fortunate patient. So all of that was incredible, and it's changed me. It's very transformative as a person, but also I'm a different doctor.
That's fantastic. Well, Rob, thank you so much for sharing your time and your incredible experience. And I think this is going to enlighten a lot of people, and particularly I think for physician colleagues who, you know, would not experience this very frequently, and just to be able to have one of their own sort of provide their sort of lived experience in this regard. It's immeasurably valuable. So thanks so much.
Joe, it was a privilege. Thank you.